for those of you who have tendinitis, knee osteoarthritis, or knee pain. And in addition, this technique ensures knee stability for sports activities such as high-impact sports, basketball, soccer, swimming, or even working out at the gym. Your knee will remain stable and will help prevent joint pain. We have a bone right here in front of the knee, which we call the patella, and it's this bone that we're mainly going to help stabilize using the taping. A very interesting point that we need to learn is this more prominent little bone right here. We call it the tibial tuberosity, which is exactly where the patellar tendon is attached. And the other important point is up here, above the patella, which is where our taping will reach. For that, step number one, our first step is to measure carefully from the tibial tuberosity up to this area here, above the patella. And we cut the tape into 2 equal parts because we're going to apply it on both sides. Step number two is to round off the edges of the tape so it sticks better to the patient's skin and so that these corners don't bother the skin. So for both strips that we cut, we're going to round off the edges like this. It ended up looking like this. And now I'll repeat the process for the other one. Step number three, now I'm going to peel off this backing paper, tearing it right here in the middle of the tape, okay? To remove this backing paper, I'm going to take it off the tape. Step number four, remember that area I mentioned where we should find the tibial tuberosity? First, I place our tape right here. I'm going to guide it around the patella, which is here, applying about 30% tension. So I stretch it to 100% and then ease it back to about 30% here. And I continue guiding the tape over the patella here, finishing up at the upper part of the patella. I'm going to repeat the same process now, but on the other side. And finally, I'm going to rub it like this to help the functional tape stick better for knee pain.